Hi, I'm Sara.
And I'm Supraja, and this is Gin and Tonic.
Welcome back to Intimate Convos with your besties.
Okay, we're back. Ooh, thank you. We're doing it.
Welcome
Episode
back.
2.
Episode do it. I'm taking Italian lessons.
Ooh, I saw your note cards. I was trying to see what your mom had written on her Italian note card. Doesn't your mom speak Italian?
It's like decent.
This
I'm not I didn't realize
is when Sarah starts to gain confidence in her language skills. All of a sudden, everyone else who is fluent is decent.
That's when like people are like, I understand all Spanish. I just can't speak it. So you don't speak it then. Let's just be clear. I'm just kidding.
She's not kidding.
It's my biggest pet. People are, I'm not including you because I know you know how to speak. I understand all of Spanish. I just can't speak it. Then you can't speak it.
I know. I honestly do get annoyed. I don't get annoyed in life when people claim languages because it's like if someone spoke English that was a little broken, I'd be like, no, you're still speaking English.
All right,
you know what I mean?
Just shame me.
But I do get really annoyed with people in the hospital, like medical professionals who like claim to speak medical Spanish because I'm like, you're not. Just because you can be like, does it hurt in your head? It doesn't mean you're connecting with someone as a human.
That's that's my biggest pet peeve when people don't use interpreters, but that's a topic for another
different
day.
topic. Not what we're talking about today. Actually, Sarah, everyone wants to hear about your date. I've been waiting to ask her.
I'll give you snippets and the full story tomorrow. I'm on this ever ongoing journey of finding a life partner.
That's the snippet?
No,
that's pretty good.
No, it was really good. I feel like I'm always telling people I want a tall brunette who's a nerd, and this dude's a scientist. So I feel like
there's like, and he's a tall brunette.
And he's a tall,
I'm not gonna say it twice.
And he's a tall brunette. So we'll see. I hope he's not listening to this.
Oh yeah, you shared it with him. Too soon. If you are listening, these are all positive things. Sarah's smiling a lot. Check it out on YouTube. Okay, well, I know we have a meaty topic today. Actually, I've been feeling very anxious about that. I came in here today with a lot of anxious energy.
Really?
Yeah. And I think maybe because I don't want to talk about my labia.
Whereas I'm like all about this episode. I'm like, let's talk about insecurity. Let's get vulnerable. It's like my jam.
I know, and I'm like, wait, why did I plan that? Why did I pitch this?
That's like my favorite like question on like a Hinge or on a dating app. It's like, I'll fall in love with you if you're vulnerable.
I know, it's true. I was actually saying that to Adam the other day. We were talking about dating apps we were talking about dating apps and like having gone on dates with people who like really have it together. And I think his app had said something that was like he like spent a lot of time in France or something. And I, in my head, I was like, no, I was not attracted to that. Like I thought it was cool you might speak French, but I was like, is this guy some like very stuck up, like had a perfect childhood, no trauma person? And then he's like, yeah, then you met me, were you disappointed? I was like, no. I was like, ooh,
you have trauma.
But he was like, that's really good.
Well, what are we talking about today?
Okay, so we're going to talk about my labia.
We're talking about GYN insecurities, specifically labia.
Yes.
Because it comes up quite frequently. Well, not quite frequently. It comes up in clinic, and we want to dismantle some myths, give you some facts, and hopefully some reassurance, or if not, some guidance in how to seek help if it is a problem.
Yeah, I think I have always not been super comfortable talking about that part of my body, which is kind of ironic because it's my entire profession. And I think with other people, I have like good objectivity and being like, we're all so beautiful. It like really doesn't matter. People really have all different shapes and sizes of bodies and it's all great. But especially growing up in like a very culturally conservative family, my family is from South India, like originally from a village, very religious, and it just wasn't at all talked about, all of the emphasis, like in the subliminal messaging was all about men, like what men want. From a very young age, I think that seeps through to like the kids from their moms not talking about it and their moms not having autonomy over it, or whoever the parent in the family is that has labia, if there is one.
But I think this is so true because it was funny. I was just sharing this with a patient today because I had a patient referred to me whose mom is a healthcare provider and they have a really adorable relationship. And I was like, you guys, I love your relationship so much. It's so funny because my mom has like no idea what I do.
I
like
know.
she knows I'm a woman's healthcare provider, but I remember one time her asking me, how do you pee when you're wearing a tampon? And I was like, Maria,
let's take a peek.
I'm like, Ma, I need you to go home and put a mirror down below. We got multiple holes down below. But my mom is from Peru and little awareness of her own anatomy. So it's not a topic we ever talked about. And it's not something I would have ever brought up to my mom to say, like, how should I groom? What is like, what looks good? What's say, like, it's just not a topic we ever discussed until I really became a gynecologist.
I know. Now when I talk about it, I'm like aware that it might be the first time someone's addressing it with that generation. You know, they never felt comfortable talking about it or asking questions. Yeah, it's funny that it has switched so much, but that like those lessons are still kind of intrinsic, even if you have, you know, thought your way out of really feeling that way. Like, so Sara, I made Sara do my pap. And I think before I walked in, I was like, Sara, I have labial hypertrophy. I just want you to be prepared.
So I know patients come in all the time and they're like, oh, I haven't shaved my legs or I haven't showered today. And we do not care if we're going to do a separate episode on this, but here comes Supraja giving all these like warnings. And I'm like, what are you doing?
I know, and Sarah's like, okay, we'll take a look at that. Like, very professional. And I was like, oh God. And then I was like, this is scaring me more. And then, I think you told me, and I'm choosing to believe you, I'm choosing to let it go, that I have very normal labia. But I never I don't know, you don't like wake up at age 8 and like have all the women in your life show you their labia. Like, this is normal. This is not normal.
Maybe that's just me.
Yeah, and anyway, it has helped me reframe and realize that it's worth a longer discussion of just understanding like what's normal, what's not normal, and when it matters or doesn't matter. And it's spoiler, it probably is normal and doesn't matter.
But I think all of us have our own insecurities and we get really preoccupied with this perception of something that we think is abnormal about our body, but other people are unlikely to think that. And it can result in emotional and physical distress for people. And so we're hoping to, address some of that distress, and it can be a wide spectrum. For some people, it's like, I don't love the way my labia look, but for other people, it can actually be prohibitive and keep them from wanting to be intimate with other people or wear yoga pants or do things that they worry other people are going to talk about. And so, that's not something I really understood until I became a gynecologist and people started bringing it up. I'm worried about how long my labia are. Like, does this look abnormal? I'm like, no, but it's made me be more conscious about reviewing anatomy with patients and letting them know, like, this is your labia majora, this is your labia minora, and going over each little part so that people know, like, oh, like I'm, and I'm letting them know this looks normal, giving them reassurance, and then if it comes up, it comes up. And that's essentially what I did at Supraja's visit.
Sarah's like, let's sign you up for therapy. Like, yeah, it was a long time coming. Side note, this is still the best espresso martini I've ever had.
I know, I'm getting
this is so good.
I feel it a little bit.
You do?
It's good. I just had a salad for dinner. I'll give you the recipe later. But it's I know, I love my espresso martini.
DM us for her recipe.
It's because it has a creamy base, and I'm all about a creamy base espresso martini.
It's so good.
Yeah.
Okay, but you said a few things that I think are super important. One, there's so many factors involved with our preoccupation on that part of our body. And for some people, it really is an issue. So, and that issue can be stemming from different things. Like for me, it probably stemmed more on the side of my own feelings about my body than really any physical characteristic. And it's not to say any of that is less real, but the way you approach it is different. Right? So I had to do a lot of self-work, and I did have a therapist, although I don't know that we got to my labia. I got a lot of other issues we got to first.
My therapist and I don't talk about my vulva. We never got that far. I quit before that happened.
But yeah, I had to do a lot of self-work of like, is this something that I'm disproportionately focused on? And if that's the case, it's like a moving target, you know what I mean? Because it's not based in an actual problem. It's based in my feelings about my body that are much more layered than that. So there's that. But then on the just physical side of it, a lot of people can have issues. Like if it's getting stuck in your clothes, if it's causing constant irritation, if it's causing pain, during sex. You think of anything else?
It's keeping you from wearing certain types of clothing. Because of the level of discomfort. Like you can't wear tight pants, you can't wear certain types of underwear. You feel like your labia are being dragged into the vagina when you're intimate with your partner. That's what people will say, or it's chafing and rubbing while you're having like intercourse with your partner or foreplay. Those are all, or sitting down. Like patients will say, like, I'm sitting down for hours and I'm uncomfortable. I'm shuffling in my chair. Whenever I'm evaluating somebody for their, discomfort or their concern, it's also like, what is like actually bothering you about it? And there's lots of different components. There's the physical component, but also what's the emotional component? Is it really something that's bothering you, or is it ideas coming from other people? And I think that's like a huge topic in itself. And the other thing being, where are these ideas coming from? Is it like Supraja was saying something like
it's all about like men watching porn.
Okay,
like how we like idealize like a weird prepubescent body. I mean, to be fair, like, I'm just gonna mention the Kardashians on every episode because although I know there's lots of controversy about them and like idealistic body standards, they did have a big role in making more curvy bodies attractive, I think. Anyway, so there's like no comment. I'm not gonna dive into your Kardashian discussion.
I did finally catch up.
Oh, you did?
I finished episode 3 on Hulu this weekend. So I'm waiting for that episode where Kylie brings up what kind of beauty standard are we setting for the world. To be continued.
But I think traditionally, at least in like my memory, what was really put up on a pedestal was like being super skinny, having a flat chest, like not being very curvy. And with that comes having a vagina that doesn't have, well, I said vagina, I meant vulva. A vulva, and we'll tell you about the difference. Sarah's really jazzed to teach you about vulvar anatomy, pelvic anatomy. But having a vulva that's hairless, has like very little tissue, which again is just what we think cis men want.
Like, who has made that beauty standard?
Right.
And why is that the standard?
Yeah. And like there are all sorts of people who want all sorts of things, and it's all beautiful, This is my self-talk. You guys are being let in.
But, interesting to explore it with some of my younger women who come into the office. They want a labiaplasty and they want their labia surgically corrected. And I think it's a longer conversation. And I think, people should ultimately do what they feel is going to make them feel confident and beautiful. But I think it's also important to explore, like, why do you think that's going to make you feel confident and beautiful? And like, is it, what your partner is hoping you'll look like? Is it something that has always been a person? And I don't think one reason is correct. I just think it's important to understand like why you feel like this before doing something that could be permanent.
Yeah. And having a real conversation with yourself about if this, surgically is going to fix that feeling. And for some people it will.
Yeah.
Some people maybe not so much. Okay, well, tell us about pelvic anatomy, Sarah. Go off. I think you should start out to in or up to down.
Well, whenever I do
you have a method.
Vulvar didactic lectures.
Okay.
So
let's hear it.
I'm no OBGYN, but I also run a vulvar clinic once a week. And so I do a lot of didactic lectures on vulvar anatomy because a lot of people aren't aware about their anatomy.
Yeah.
Patients, my mother being one of those examples, she may be listening to this.
Maria's gonna love this.
Maria Elena is listening. But providers are also not aware of anatomy. You know, I'll often get emails saying, this patient has a red spot on the vagina. And I'm like, it's not the vagina, it's the vulva. But I think the more we're aware of our own anatomy, the more we can advocate for ourselves, the more we feel comfortable knowing, like, actually, this is normal. This is a normal anatomical variant.
Yeah.
And those are my favorite kind of visits where I get to review those parts of the exam with the patient. I always use the right terms. But essentially, like, if you think about the borders of the vulva, and this is a little bit debatable, but in general, it's, you know, the top border is your mons pubis. So it's that fatty pad of tissue above your pubic bone where essentially pubic hair grows unless you groom your pubic hair away. Then you have your inner groins where your inner thighs are. And then the bottom border is the skin between the vagina and the anus. It's the skin, the perineum, essentially where people tear when they have a vaginal delivery. And then as you go inside, the next layer you hit is the labia majora. Most women have flat labia majora. That's not the larger labia that we're referring to. And
Not me.
and the labia majora is what grows hair. Then that's what some people will groom. And I'm just kidding. I'm just kidding. Well, I'm not actually. Well, anyways, we'll get into that later. But then there's the labia minora, which are the smaller lips. And those are what can vary in shape and size, kind of like our breasts. They can be asymmetrical, they can be identical, they can be longer. And I'll always point them out to the patient. These are your labia majora, this is your labia minora. And then within the labia minora is the entrance to the vagina or the hymenal remnants. So, you know, and then the hole where you void from or urinate from, the urethra, is within the labia minora. So, you know, that's a basic understanding of vulvar anatomy. But the labia minora can vary from one woman to the other. They can be asymmetrical. They can be areas of discomfort. They can, you know, have dermatological conditions. There's so many things that can go on. And Supraja is going to tell you about some resources where you can look up the many different types of labia.
The Large Labia Project. What was the other one?
The vulvar wall, or
the Great Wall. The Great Wall of Vulvas.
Yeah.
We just said that wrong. I'm sorry. But I've looked at the Large Labia Project a lot. I think it's so helpful, and it's helpful to tell other people too.
I bring it up during visits because patients will tell me, like, my other doctor mentioned I should consider a labiaplasty or something. I'm like, what?
The doctor.
Yeah, I had a patient come to me one time. She's like, well, I should consider that, right? And I was like, let's talk about that.
You're like, why? They're like, because they told me to.
Yeah,
I'm like, okay. We're taking names, folks.
I know. Let's explore that. But I have a textbook that I bring with me to clinic, and we'll go through pictures, and I'll say, this is what your vulva looks like. This is normal. This is a normal variant.
Yeah.
You know, and I will frequently use the example of breasts. Like, nobody's two breasts are identical. Every part of nothing is always symmetrical. And I love showing people photos, and they're like, oh, you're right. That is what my vulva looks like.
I guess to review, the times where it might be worth further investigation. I think if you are having a lot of emotional distress over it, it's still worth talking about whether or not the way to fix that is surgery or something else. It's still worth bringing up with the doctor.
And I love it when people bring up these kinds of topics, and we can spend the whole visit talking about it and exploring it, and I can give you my perspective. Those are fun. I think those are fun visits.
And also a good point of we're not all built the same, and you're not going to vibe with every doctor the same. So if you're in a doctor's visit where it's a really simple answer and it might not have addressed all of the anxieties you have about it, maybe that's not the right doctor to have the conversation with, but there is someone out there who hopefully you could have a really productive and nuanced conversation with. And then 2, there are physical things that can suggest someone should talk about it or have it looked at, or if it is painful, irritated, other times where you're noticing it excessively, like sitting for a long time that you feel discomfort. And then I know, Sarah, you've mentioned like the length is a little bit controversial, but there is technically a cutoff.
There's like a subjective measurement that people will use to say like, well, I guess you could consider this hypertrophy, but there's really no like standard like it's just subjective number. But when you measure the labia, you start at if you separate the labia minora apart, and you start at one tip and go to the other tip in a horizontal direction. You're not super stretching it, you're just gently separating. They say 6 centimeters, but I have lots of patients, like that's quick to hit. I have a lot of patients who have labia much longer than that, and they're not bothered, and you don't need to do anything about it.
Then it's not an issue, yeah.
I've also had patients with labia shorter than that, and it's one side is causing discomfort, and we've ruled out other causes, and we've surgically corrected it, and they felt better. And so there's no one standard. It's really each individual case.
Yeah. And I think too, it sometimes when we have really strict definitions we adhere to, which like we just said, this one we don't personally adhere to it like that in our practices, but when you do, you're not really accounting for other factors. Like I take care of a lot of trans and gender diverse individuals who are on testosterone, which makes parts of that part of the anatomy bigger or smaller, and it's not really taking that into account. There's lots of things like that that can affect your anatomy. I think the highlights are what you said, like it either should be causing you great distress or causing physical symptoms that are bothersome. If you patient and you really feel like surgery is the best option, that is usually an outpatient surgery. Sarah's our vulvar specialist here, so I'll let her tell us all.
So I do labia. I do labiaplasties, but again, I do this like heavy screening process to really understand the patient's perspective and answer any myths, concerns, go over pros and cons with patients before we do this, because again, it's permanent. We're changing a part of your body, and it's a really sensitive part of your body. But once we've decided like this is the best option, I tell people there are multiple people in medicine who can do this: gynecologists, urogynecologists, plastic surgeons. When I specifically do it, I don't do it for cosmetic reasons. So if you're going to a provider because like the cosmesis is the most important thing to you, then I tell people like, I'm not your best surgeon. I'm doing it for functional or physiological reasons, meaning you're having discomfort. You're okay if it doesn't look perfectly symmetrical. Granted, I obsess and do my best to make it look perfect. Literally.
Me too. Well, going in that there's so much emotional weight to the surgery you're about to do, which maybe is true for a lot of things, but I feel personally connected.
Yes.
So it's true. It does carry. I think I obsess when I do those surgeries too.
I literally went home after the first one I ever did of one of these I did as an attending, and I went home and I like sobbed in the shower. I was like, yes, I was like, oh my God, is she gonna like it? Like, so nothing we do is cosmetic other than like the incisions we close, but we've done so many that's not that big of a deal to us anymore. But like I feel like this is just like so different from everything else we do that I want the patient to be happy. I want her to feel confident, and so I put a lot of pressure on myself, and that's why I heavily counsel patients like, you can also go to a plastic surgeon. But it was funny because when I spoke to a plastic surgeon once, she was like, "Oh, these also make me anxious." I think
it's like when I just put the new boob in, people are happy.
But I think it's because I'll follow some plastics people online, and they're like, and then I'm like, no, that's not my process. I I meditate before the OR. I channel I superwoman pose before I scrub, but. Yeah, so I tell people there are many different people who do them. There's many different techniques. I do a straight cut, like curvilinear technique, but other people do like wedge techniques. What I'm trying to say is that there are many different surgeons who do this, and I think it's fine to shop around, talk to people, go to who you feel like is listening to you, who you feel like you vibe the most with.
Yeah.
And it is an outpatient procedure in general. These usually, once the patient is under anesthesia, takes about 30 minutes. I've done them as quick as 15-20 minutes, but in general it takes about 30 minutes, and you're just removing the excess skin so that the labia minora is flush or even level with the labia majora, so it's not extending too much further out. And then you're just putting a few stitches, and those, after the surgery, the labia, what remains, gets puffy. And so I tell people, you're going to feel puffy and swollen. You're going to feel like you're waddling. It's uncomfortable. That discomfort usually lasts for about 1.5, 2 weeks. You'll still be healing for a total of like 4 to 5 weeks, but the most of the discomfort's in the first 2 weeks, and the stitches pop off on their own. And
I like the description of them popping off.
they just like they just
That's
pop
what I
off.
tell people too. Yeah, and I have people, I draw it out for them, measure it, and then in the office I'll like put a dot on their vulva and make sure that lines up with the picture we've agreed on, and then I show it to them again. Just because it's, I don't know, no one's spending all their time like looking at their vulva, and you want to make sure that you're doing what they wanted you to do, because people do have such like intimate feelings about it.
I feel like when I've done these with the residents, they probably think I'm a psycho because I'm like so meticulous, but it's like it's so important, and I want the patient to know, like, I know, this matters.
Yeah.
And but yeah, it's actually a pretty straightforward surgery, and the recovery is not too bad. It's about a month. You can go back to work after a week or two if you want to, and it should look beautiful after, and I think it generally does. I've seen some unfortunate cases from not from
that I didn't do.
I've seen some unfortunate cases from abroad, and those make me really sad. And so I think it's important to abroad, like I don't know where I'm going with this. I'm just saying. I know.
We know that there are very gifted surgeons abroad as well.
Well, no, I had this one patient who had it done after the delivery, like shortly after the delivery of her baby in another country, and they even sewed up her perineum so it would be more comfortable for her partner.
Oh my God.
So you can just imagine the approach that the objective and the agenda
was
of her
very sexist.
Yeah, it's very different. And so that's why I mentioned know who you're going to, ask questions. How many of these have you done? What's your technique? What do you think?
Yeah.
I think those are all really important questions that I would ask anybody who was doing surgery on me.
Yeah. And I mean, I think you're very data driven, which I think is great in your personal life too when you make choices. I feel like I am very instinct based personally, not necessarily in medicine, my medical practice, but at least like when I make big choices, I'm trying to think if I was at a doctor's office. I think all those things are important. And then I think it's also important to trust your gut. Like if you feel like this person is just kind of rushing you through it, is not really explaining it to you well, find someone else. There's lots of other doctors who will do it, So I think making sure you feel really heard and that it's someone you're going to be able to go back to and ask more questions afterward, or that you could reach out to if you had concerns about it even afterward, is really important.
Yeah. So that's the procedure itself.
Yeah. And all of this episode is to prove to me that my labia is normal, and Sarah's promised to build me up.
So I think we wanted to conclude the episode with appreciating how different each of our bodies are, and different does not mean abnormal.
No.
Unless it's causing some kind of physical or emotional distress. So then explore it, ask questions. But I think it's really important to really know our bodies and celebrate them and talk about our friends. And I think we're lucky because, I'm like, Supraja, look at my vulva. What is this?
Literally, we were like, I think it was New Year's or something. And Sarah wanted to show me how she groomed. So she just lifted up her skirt. And I think it was really funny because it was me, Sarah, and then 2 other gynecologists, and then my other best friend who was not in medicine. And she was closing her eyes being like, am I allowed to look? It was really sweet. Or Sarah's just standing there being like, this is what I do.
Well, because I take grooming so seriously.
It looks great.
Because
A+.
I feel like my whole life, the way I groomed was based on what I thought was expected of me. This is what a guy wants me to look like when we're in my bed. And it wasn't until I met somebody who was like, oh, I like the opposite. I was like, oh, I've never thought about that. And I was like, okay. So I changed things up, and I was like, actually, I like this. This is more convenient.
Yeah.
And I think it's we're so fixated on what mainstream wants, but everybody's different, and and at the end of the day, yes, I was changing things up for different partners, but at the end of the day, I figured out like what I liked about myself, what made me feel feminine, what made my life convenient. And so I feel like it took me getting into my like early 30s to like really own that.
Yeah.
And so now I love like, look at my vulva.
I know. Yeah, and I mean, I have had partners before who had a lot of comments about my body, not my vulva, but had comments. I think that I would have known to run, but like would comment about like me shaving my legs and things like that, where you do feel like, oh, there's one standard of beauty that I'm not quite living up to. But then I shouldn't have stayed with those people. I mean, maybe for other people it wouldn't be such a big deal, but for me it did affect my self-worth. And then with Adam, like he just tells me how much he loves like every single thing about me, including all of my body, which I just choose to believe him and it's great. But I think it does mean there are people who are going to love you for how you love yourself. And those are the people that you want to find.
And I think if you just give off that sense of confidence and like, this is my body, I own it, I love it.
Yeah.
People are like, the right person is going to think that, damn, that's hot. And if they don't, like run. And
I'm already wondering if my ex is going to listen to this.
I'm trying to think. I hope mine doesn't because I hate him so much. Just kidding.
Oh God.
But
let's wrap this up.
Let's celebrate our bodies. Let's own it. Let's ask each other questions and find a GYN that you trust and have good rapport with. So it can be, a fun, reassuring convo.
Yeah. Find one like Sara who will then start a podcast with you and do a whole episode about it. Love ya.
Love ya.
Bye.
Bye. Did you like that?
Then like and subscribe.
Please.